Public Health 2020. So we move on to the next segment of the conference, which we do have a very important segment, and a very interesting segment coming up. We have the industry workshop. So the industry workshop will be on the title, Workshop on Business NGO Partnership, a Building Workshop. So I would like to take this opportunity to introduce the moderator and the panelists for this session. So I would like to introduce the moderator officially. We do have Dr. Alene Gelbard, who was our co-conference chair. He is the founder and the principal of Access Partnership, and also the adjunct professor of social enterprise in the American University, Washington, D.C., USA. And then I would like to introduce each moderators very quickly. So first of all, we do have Mr. Sonny Sukada, he's the executive director of CCPHI Indonesia. And then we have Mr. Karyanto Wibowo from the Sustainable Development Director from Indonesia. And then we have Mr. Don Johnston. He's the Operation Director of Water Organization Indonesia. And then finally, we have Mr. Govert Waramori from the Community Health Department Manager from Freeport, Indonesia. To officially start the proceedings, I would like to officially hand over this workshop to the moderator, Dr. Alene. So Dr. Alene, it's over to you.
Thank you very much, Austin, and welcome to all of you. We have a terrific panel of experts you just were introduced to on this topic, and I will introduce, well, I won't introduce them now because they've already been introduced, but looking forward to hearing from each of them. And before I get to their presentations, I just want to take a moment to repeat something that I said in my keynote speech yesterday. I described the origin and development of a social innovation in business NGO partnership building. And just to remind everyone what a social innovation is, as opposed to other innovations, it's defined as being more effective, efficient, sustainable, or just than existing solutions, excuse me. And it benefits the whole of society rather than private individuals. Importantly, it also cuts across traditional boundaries that separate businesses, nonprofits, and governments. So today you're going to hear a lot more about this social innovation that is comprised of a mechanism called the Partnership Forum and the Indonesian nonprofit called CCPHI that runs it. Both represent unique resources to help businesses and NGOs partner for community health and sustainability. As the originator of this process that led to this innovation, I can't begin to tell you how rewarding it is to see what has happened during the years since my organization, Access Partnerships, was no longer involved. Those of us who work on international development always talk about the need to produce sustainable results, but it is our Indonesian colleagues that have made both CCPHI and the Partnership Forum increasingly sustainable. They include colleagues with whom we began working in 2008 to create and develop the forum, the Indonesian Ford Foundation representative who supported the work needed to launch and implement the forum, Indonesian colleagues who built CCPHI and ensured the increasing sustainability of both the forum and CCPHI over time, and the businesses and nonprofits operating in Indonesia that participate in the forum and other activities of CCPHI. And you will be hearing from them today. So our purpose is to share with you the skills that are required for successful partnering. And I just want to use this slide to describe where these skills fit in. I'm going to list them, and during the next hour, we'll be asking our panelists to discuss their experiences regarding these skills. They'll be giving presentations, and then we will also discuss the skills after that. And I hope there will be enough time for questions, because in addition to the panelists, we have two members of the Ministry of Health from Papua, Dr. Eni Kenangalam, excuse me, and Dr. Faustina Helena Burdam, and they will be available during the question and answer period. So let me just go through quickly the skills that we're going to be covering. We start with networking on the bottom. These are the things that are the first step in developing partnerships. Networking and building relationships, then building relationships and that lead to trust, and initiating a partnership. And in there, we'll be talking about how do partners initiate their partnership, who initiates it and why, and what kind of mechanism do they use? Most frequently, it's a memorandum of understanding. And so we'll be hearing about that from the panelists. And then that leads to the strategy, which then has roles and responsibilities, resourcing, communications, timetable, and monitoring and evaluation. And that's all part of preparing for the implementation, and it is part of the implementation. Those lead to activities, which is the implementation, but as you can see, that feeds back to this whole line of elements of a partnership.
Dr. Sorry to interrupt. Are you sharing your PPT right now?
Oh, I think I thought I was. Oh no.
No, we can't see that. I just want to so you can share the screen so we all can see the PPT.
You know, I thought I was sharing it, so I just.
That's all right. That's all right.
I'm so technologically challenged. So let me see. How do I? Okay.
You just click share screen in the bottom. There's a green icon, so you click there and then you choose.
I thought. Yep. Hold on, just a second, please.
No worries.
All right. And then I've lost it again. Do you have it, Austin? Because I've got too much stuff again. Hold on just a moment, please. I don't know how to get it back so that I can share it. Do you have it in your file? It'll be the 3 that I sent you. It'll be one of the 3.
Is this the one you want to share?
No, this is CCPHI's presentation.
Okay, let me check. Okay. Just one moment. I'm trying to check it out.
This is the first time, everyone, that I am doing share screen, so.
It's okay.
Is the one that you want to share?
No, that's Freeport.
Okay.
Right.
Okay. So let me check right now. So do you find it in your PC? Can you? I
do. And okay. I've just.
So
it says, wait, it says I cannot start screen sharing while the other participant is sharing.
Okay, now I'm not, so you might be able to share it right now.
All right. Yeah, are you seeing it?
Not yet.
Okay. Hold on just a moment.
Did you find it?
I have it. I'm just trying to get it so that.
Okay, just click share screen and then you can select the PowerPoint and then you should be fine.
Yes. That I know. I'm trying to. It's. Do you see it?
Not yet. No.
Okay. Well, the problem is that.
Okay, now I can see it. Okay, now I can see your screen. Okay.
Oh, good. Okay.
Okay, so you just need
to. Now I can't.
PowerPoint and then we can see it. Yeah. So we can see your screen.
You can see it. Okay, yes. Good. Now I can't see it.
Okay.
Well, with everyone listening, I hope that it's a great.
Yes, let me try to find out the PPT. Just give me 1 second.
No, I just
let me try it from my side.
Please do. But I don't want to delay. I don't want to take up. I really want to hear from the panelists, and I want to be able to, if it's possible, to show it while the panelists are speaking. I don't know if you can even do that.
Dr. Is this the one that you want to share?
Nope.
Nope.
Not the one. Okay, so we have 3 PPT. So that's all PPT we have. So just one more last time from your end.
Yeah, I sent it to you again this morning.
Let me double check again. So you last,
Okay.
let me try it from my side.
The problem the problem is, as long as you are hosting, I can't share the screen.
I gave you access now, so you might be able to share it now. So I stopped sharing from my side.
Okay. Let me find it then again. Hold on just a moment.
I think I found it. I found
Oh,
it.
did you?
Yeah.
Okay.
Is this the one?
Yes.
Oh,
Yeah.
finally. Okay, now it's all to you.
Finally.
Okay. So let me. So how do I get to the second one? There we go. Okay. So let me just go through this quickly again, that we'll be talking about networking, and these are all the things that were in the flyers. So I hope that they're all sounding familiar to you. But basically we'll be talking, these are the building blocks based on the experiences of businesses and NGOs we've worked with. And this is the foundation of the course we teach at American University on partnership building between businesses and NGOs. Basically, it starts with networking, relationships, trust. They will have done individual need assessments separately, but we will be talking mostly about these three things. Then in initiating a partnership, who initiates it and why, and what kind of agreement do they make, and so that they can come to mutual understanding, mutual needs and benefits. And that's frequently an MOU, which you'll hear about from the panelists. And then the actual implementation, and that is all of these things that lead to the activities, and that, it's a two-way relationship. So as you do activities, you also are communicating about them. You are maybe changing roles and responsibilities, but you have a foundation for all that, and monitoring and evaluation. So with that, let me move on and introduce Sonny Sukada, who is the executive director of CCPHI. And he'll begin by talking about what CCPHI does and its role in partnerships.
Thank you, Alene. Please allow me to share screen, and I do hope that I'm not experiencing the same like you do. Okay. I think this is. So have you seen it?
Yes.
Yes.
You just need to make it full screen so we can see it entirely.
Okay. Where is it to find the, oh, sorry.
Are you on a Mac?
Yes.
There you go.
There you go.
Yep.
Okay. Thank you. Thank you. So can I start?
Yes.
Okay. So CCPHI is basically a continuing works of Alene back years ago in Indonesia. So CCPHI is an intermediary organization that promotes and facilitates multi-stakeholder partnerships between the private sector, non-government organizations, and governments at the national and local levels for healthy and sustainable society. As a continuation work of Alene, then CCPHI was established as an organization in 2011 to respond in mobilizing resources to accelerate the achievement of the SDGs. At the moment, we have more than 380 members from various sectors, like companies, associations, NGOs, CSOs, media, and education institutions. So basically what we do is we help a partnership forum, that it can be a government-led initiative or donor-led initiative, or even a tailor-made services. But we also develop a knowledge management. CCPHI facilitate partnership forum for multi-sector representative as a platform for building mutual trust and expanding networks through information exchange and sharing evidence-based experience. And it is hoped that the presence of this forum can foster new partnership opportunities and become lesson learned for those who wish to start partnering. CCPHI document its discussions into a downloadable case study as learning material for organizations wishing to partner. With Yayasan Cipta Cara Padu, we organized the Health and Business Forum, which aimed to developing the health sectors by sharing experience between the organizations. The topics discussed in the Health Business Forum varied, such as general health, safety for pregnant women and childbirth, infant and toddler health, adolescent health, nutrition, health services, including midwives and community health centers, gender issue, HIV, and AIDS, TB, and other related topics. Another one is Research and Business Forum. Partnering with the NGO or even the government. Through this Research and Business Forum, it is expected that the participants will understand the link between research and public policy and open opportunity to build partnership in the field of policy making. One of the outcome of the Research of Business Forum is the signing of the MOU between Eurochamp and the Center for Indonesian Law and Policy that is facilitated by CCPHI and supported by Knowledge Sector Initiatives. On research, we have conducted data collections on the profile and the social sector in Indonesia as part of the Doing Good Index Asia Research in 2018 and 2020 for the Center for Asian Philanthropy and Society. And also research on sustaining open defecation free on cities and regencies for SNV Indonesia. Another example for tailor-made forum is when we work together with the World Research Institute to disseminate the accountability framework initiative, which can be used by the private sector in establishing general definition, norms, and sustainability practice to meet the company's ethical supply commitment. The principles address the environmental and social scope of company actions and their implementations and monitoring mechanisms. Another example is when we work with Burung Indonesia, Indonesian BirdLife, presented bird conservation activities, including community empowerment and mapping of interest and input from the private sectors to enable them to contribute through CSR programs or philanthropy in the environmental sector. We do also the capacity building, such as workshop on integration of one Danone stunting prevention program and workshop on the development of post-harvest network for Indonesian nutrition as a newly established organization supported by Indonesian cold chain and GAIN. Because of the pandemic, we cannot do a usual forum, an offline forum. Then we do an offline activities on the webinar in collaborations with UN Women on disseminations of women empowerment principles, with the Center for Asian Philanthropy and Society on disseminations of the results of doing good index survey in Indonesia 2020. And lastly, we just hold a webinar working with Ministry of Health on stakeholder participation in complying with the health protocols so that the public health is restored and the economy is revived. Other than forum and discussions, we move forward to develop an executive program for sustainable partnership. It is a collaboration with Paramadina University and supported by the Ford Foundations. The EPSP, the Executive Program for Sustainable Partnership, aims to enable executives to build trust between sector and increase knowledge and skills to achieve effective partnership, to respond to the needs of cross-sector partnership in social, economic, and cultural contexts, and to develop, implement, and evaluate partnership through learning and evidence-based approach. As a continuation of EPSP program, a curriculum of partnership for postgraduate has been developed and implemented since 2018. We also develop a partnership tools that can be downloaded in our website about looking for the right partners, define a successful partnership, communicate a successful partnership, and facilitating partnership. As I said earlier, that all the activities, whether it is a forum, a discussion, a research, can be downloaded in our website about the case study, about media article, partnership summary, knowledge stories, and meeting notes, but the meeting notes only member can access. So basically that's all my presentation. Thank you.
Well, that's fantastic. And again, I have to say, after it's amazing all the things you're doing. And I look forward to us staying in touch. There's so much we can all learn from how you've evolved and all the various activities. I have lots of questions, but we're going to move on. And I would next like to, and we will have a question and answer period. I hope even if we started late, we can go a little bit later. I would now like to introduce Karyanto Wibowo. Am I pronouncing your name correctly, Karyanto?
Yes, perfectly.
Oh, great. He is the Sustainable Development Director of Danone, and he will give a presentation on his company and what they're doing, including through partnerships. Would you like to start?
Yes, I will share my screen. All right, so good afternoon, everyone. So thank you so much for the opportunity. So I'm Karyanto from Danone, Indonesia. Actually, I will be co-present with my colleague, Pak Don Johnston from water.org, just to share you on our partnership related to water access in Indonesia. So because this is really a co-partnership, which is we built since couple years ago. A quick one on Danone. So basically, we are a food company. I would say our vision is one planet, one health, because we believe that actually the health of the people and the health of the planet is interconnected. And our mission is to bring health through food to as many people as possible. This is the reason why actually all of our portfolio actually categorized as healthy product. Then because we are based in Indonesia, very quick introductions on our company in Indonesia. Basically, in Indonesia, Danone was entered into M&A, merger and acquisitions, but most of the brand is actually a local brand. one of the local brand is Aqua, this is the first packaged water in Indonesia, established 47 years ago to help Indonesians get access on healthy hydrations. And the second one is this is also kind of a heritage of Indonesia as well, which is Sariwisada. It was established more than 60 years ago in Yogyakarta. Actually, this is the initiative by Indonesian government. That was the initiative by Indonesian government and also UN to provide access for healthy food or access to the nutrition for Indonesians. And then now the company is really growing. And then Nutrisia and also Nutrisia Medical, that this is established in 1997 and 2009 in Indonesia. So basically, this is our, I would say, the product which is we really offer the health-focused portfolio brand. The first one is more that we really provide the product which is coming from the naturality, which is we have the packaged mineral water. But I just want to take the opportunity to share with you that basically most of our product is really circular through aqua jugs in this big format, which is account of 70% of our portfolio. The second one is basically a healthy product based on the science base, which is relevant, which is the first local innovation, which is really relevant to the local and also clinically proven for Indonesia. And at the same time also, we are trying to be a responsible business company. This is the reason why actually Danone Aqua is certified B Corp corporations. We are one of approximately 3,000 company all over the world which is certified by B Corp because of our highest performance in terms of the governance, environment, transparency, accountability, customer, and also how we work together with our employees. This is on the impact in terms of the economics and also business. We have, as I mentioned before, we have a lot of product within healthy categories. We have 25 plants, and then working together with 1.5 million outlets all over Indonesia to help distributing our healthy product, which is involving more than 2 million of people, which is directly or indirectly depend on our business. And then we have 15,000 employees all over the world. So this is basically our business. But I think go back to the Indonesian context, I think we all perhaps quite exposed to the topic, to the issue related to water, which is I would say 10% of the household in Indonesia still don't have access to the clean water access. 10% perhaps, I don't know whether we can consider, okay, this is a small percentage or maybe big, but if we convert into the number of Indonesian population, we are talking about almost 26 million of people, which is quite a lot. And then the second one is about 70% household with sanitation facilities, means 30%. 30% means 90 million of Indonesian people. And then, of course, this situation will lead to the issue, which is quite scary, on the stunting. 27% Indonesian children exposed to the stunting, which is about 7 million of Indonesian children, which is we have to address this seriously. Otherwise, there will be a potential of lost generation in the future, especially Indonesia will get kind of a bonus of demographic soon. Therefore, we have to make sure that our children is really, able to grow as we expect. And then, of course, the role of water access is very important. Water access and also sanitation and hygiene is very important. To help Indonesian government to reduce the stunting. So then how we address as an industry, basically it is reflected in our water policy, which is we have 3 water policy, which is we commit to preserve water resources and natural environment. And then the second one is we as a company we use water, then we have to be able to be responsible in our factory, how to use water responsibly and give back the water from our production back to the nature clean according to the standard. And the last one, which is this is very important, we committed to provide safe drinking water or access to safe drinking water or access to water for the vulnerable communities. So this is actually our WAS program, which is aligned with SDG number 6, which is how we try to improve the community health through the better access on clean water and proper sanitation, and also the behavior change. We have done this initiative since years, since the company is really established. And then actually now it's, I think this is quite some achievement, which is we do the initiative all over Indonesia, near factory and also outside of our operations, which is for the time being supporting 70 villages in the 21 district, and then more than 25,000 of house connections, and then giving the impact to more than 330,000 of people all over Indonesia. So I think this is something which is we really want to still to keep give bigger impact in terms of the water access. And then this one is basically the coverage, how we do the WAS program. So of course, when we do the WAS program, water access and sanitation hygiene, we support the construction of water and sanitation facilities. At the same time, also we do the capacity building, because at the end, it is very important for the community to further sustain the initiative and also bring impact to the surrounding. And then the second one is the third one is basically we do the educations, we campaign on the health and hygiene, and the coverage of our WAS is also do the WAS at school, and then how we connect our WAS initiative with stunting preventions, and then WAS during the emergency, during, for example, the natural disaster. As you know, Indonesia, we have many natural disaster where we have to be able to respond immediately which is WAS is becoming very important during the natural disaster. WAS at workplace, which is related to our people, we need to make sure that our people has the access on WAS either at the workplace and also at home. And then the financing scheme. And this one is basically our strategy. I mentioned before that the community-led total sanitation is very important, because at the end we have to empower our community, and also the participatory is also key. How to ensure that the community will have kind of ownership and involvement for this program. And then we take also the opportunity to involve our consumers, because this is very important as well, to inspire more people on water access. So through our CRM, cost-related marketing, we engage our consumers to participate, to join this kind of initiative, it was quite successful campaign in Indonesia. And then last but not least, of course, multi-stakeholder partnership. At the end, we are not able to really work alone. We have to engage with our relevant partners, with the NGO, media, other private sector, and of course the government is also very important to be part of this initiative. And then this one, Pak Don will explain more, that basically with regard to the partnership back to 2016, finally, I would say it was very lucky for us to meet water.org, which is now we have quite, I would say, strong partnership with water.org to help us, to support us also to increase the impact on the water access through the microfinancing scheme, which is it has really proven the numbers of beneficiaries that I mentioned to you before is also with the support of the water.org to really significantly increase the coverage on the water access. And then now I would like to hand over to Pak Don to share on what is the water microfinance and also water.org initiative in Indonesia, how together we create significant impact on the water access. Thank you.
Let me just say a word. That was fantastic. And it's amazing what you're doing. And I hope countries around the world can learn more from your involvement. But let me let you now. Don Johnston will talk about Water.org's contribution to this this effort, which is extraordinary. Thank you very much, Karyanto.
Thank you. Can everyone see my screen now?
Yes.
Okay. I'll try
Yes.
to see if I can get it. There we go. Full screen. Yes, technology is working. Indonesia is a country that can pull you in. I came to Indonesia with the intention of staying for 9 months as a graduate student, and that was with an interest in microfinance, and that was more than 30 years ago. And I've never really gone anywhere else since then. I've had the privilege of working in microfinance in different areas for all that time. And most recently, I've had the honor and joy and privilege of working with Water.org here in Indonesia, using microfinance to try to solve the problem of water and sanitation access for low-income households. As an organization, Water.org started small. Our co-founders quickly realized that if you start with the mindset of digging wells and providing water and sanitation access household by household or even village by village, that you would never make a dent. And so the light bulb moment came with the realization a little over a decade ago that microfinance could be used and could be channeled as a way to bring access to households that, although their incomes are low, they still have the capacity to solve their own problems. And so microfinance became a key tool for helping to ensure access to water and sanitation for low-income households. And Water.org is working in 15 countries now, including Indonesia, which is a very strategic country for us. That work in making sure that classic microfinance is available to households and helping them to enable their own to find their own solution for water and sanitation access. Also had the benefit of bringing us into the market and helping us, getting us started in looking around and I say us, as my predecessors, I can't take credit for it. Looking around for potential partners, for interesting opportunities, so that Water.org, which is not a financial institution, could find partners to work with, whether they're financial institutions or stakeholders who can help enable the demand, who can explain to households how to better access water and sanitation facilities and the importance and what constitutes good access. In the course of doing that, we discovered a couple of things that looked like they had real potential for big impact. One was the discovery that the government had been operating a program called PAMSIMAS, bringing basic water infrastructure to villages, rural villages throughout Indonesia. There are now more than 28,000 villages with this water infrastructure. So when we looked at them, when Water.org looked at them, the conceptual step that changed was that Water.org was able to look at them as potential micro enterprises, that these did not have to be viewed as a purely social organization, and indeed they were already collecting fees for their operation from households. But the idea was to bring a sharper focus on these community-based organizations as micro enterprises, and therefore unlocking the potential for microfinance as a way to help them expand. Because as the diagram shows, just because although the initial infrastructure was provided by government, this infrastructure was never sufficient to cover the entire need of the village. At best, it might cover half the village, very often less than that. These community-based organizations needed a way, and still do, need a way to expand using their own resources as much as possible to serve more households within the village. At the same time, there's potential because people want water, they're willing to pay for water. If they don't have a piped water source to their household, they're paying a higher price for the water they get anyway. There is a real possibility for creating a sustainable business here. And creating a sustainable business that's going to generate cash flow needed to repay loans. And so water.org set out on the path of trying to demonstrate that CBOs could be sustainable micro enterprises, that they could be credit worthy, and then to prove this and to develop enough of a track record that we could start on the path of scaling this up and bringing the idea to all of those CBOs throughout the country. And this is where, early on, in addition to identifying the government program, PAMSIMAS, as a stakeholder, at the beginning, the relationship was more of no objection from the top, allowed us to do to find a couple of districts in which we could start the early work. But we also were fortunate to discover a kindred soul, to find Danone Aqua, which was looking for a way to scale up, that they were, in a way, they were having the same idea, that there needed to be a way to increase people's access to water in rural areas, but to try to do it with the potential, in a way that had a potential to scale up. And in working with Danone Aqua, in effect, we took the approach of working in parallel. That water.org has its own working area. It's basically Central Java and now a bit into West Java. At the same time, Danone Aqua was working in East Java, following the same methodology. We could provide technical support and technical supervision for the team created by Danone Aqua, but we're both doing the same thing in over a wider area, which enabled us to develop this record of success at the local level more quickly, and also to achieve a higher impact based on that record of success more quickly. That track record then enabled us to essentially circle back and develop a stronger relationship, a formalized relationship with the government program PAMSIMAS, which is operated through the Ministry of Public Works and Housing, and then to use that. It started out as an MOU, now it's a cooperative agreement. It's a little bit stronger. And then going back to the local level, the local areas where PAMSIMAS is being implemented in order to leverage that agreement from the national level as a way of developing closer and productive working relationships with both the government program PAMSIMAS, which is supervising and helping to establish these community-based water supply utilities at the village level, and also identifying local financial institutions willing to lend to the good ones, the ones that are already sustainable. So there is very much a process of identifying partners, working with them to find a way to establish that track record of success, and then leveraging that track record of success to build more stakeholders to try to scale up and to scale out. And that our ability to work with Danone Aqua has meant that we have been able to move much faster in demonstrating the track record of success. And that I should say that track record of success continues performance-wise even during this COVID era, when a lot of enterprises are facing difficulties. By and large, people still want access to water, and so both the financial operations of these village-based water enterprises, the community-based organizations or CBOs, and the ones that are borrowing are still are still repaying their loans at a rate of more than 96%. If there were no COVID, it might be above 97%, a little bit closer to 98. But overall, repayment is still good, and demand is strong because people know they need water. When these loans go to water utilities, village-based water utilities, it is for small-scale infrastructure that is going to benefit their mini network as a whole. It might be reservoir construction. Mostly it's going to distribution pipes or household connections along with the water meters for each household so that people pay for the water they're using. And so in doing this, we've had the great good fortune of being able to work with Danone Aqua. We've learned quite a bit in partnership. We've learned faster, I would say, by being able to work in a wider area, going back and forth with Danone Aqua between different parts of Java. We're now ready, I think, starting in Java, because that's where the concentration of poor people is. I think we're ready and are eager, basically, as soon as we can figure out the logistics in a slightly post-COVID era of moving off Java and taking our show on the road. In doing this, this is obviously a multi-partner strategy. There is the peer partnership between Danone Aqua and the team that they established and water.org, working essentially in parallel but learning from each other while we were doing this. Also working with the government program PAMSIMAS to establish the cooperative agreement at the top, and using that to circle back to the ground level to establish that track record, taking the learnings from the ground level and then bringing it back to influence the national training program that is instituted and implemented through PAMSIMAS. At the same time, all of this, the beating heart of this work is the partnerships with local financial institutions. And when I say local, in the beginning, it was very local. These were small financial institutions, beginning with non-bank financial institutions, very often Sharia institutions, then moving, in a way, moving up a step to or slightly larger institutions, what are known as BPRs, or community district level banks, very often owned by local government. The water.org has Danone Aqua has enabled us to work in East Java in partnership with a province scale bank called Bank UMKM, the small and medium, or micro, small and medium enterprise bank. This is a step up for us in terms of scale, and we would have had difficulty doing that without having been able to work with Danone Aqua at the same time. The learnings from that, I think, are putting us into position to envision a national strategy looking ahead. And so we've got, we've had a model that in some ways looks like it's constantly going back and forth and thinking about how we can develop, how we can change the nature of the partnerships for good in each case. But it takes a set of people who are committed to partnership and to thinking creatively about partnership and not letting the partnership sit still. I'm fortunate to have a team at water.org that is constantly looking around for who else can we partner with and whether we can do something different in the partnerships we have. We've got one of the things that we've figured out more recently is that local banks, very local banks, are often nervous about not being able to diversify their risk. And so we have, by working with guarantee institutions, been able to back up those banks so that we can provide a partial guarantee product, or facilitate, I should say, a partial guarantee product for them through guarantee institutions, so that the financial institution is not carrying the concentrated risk of lending to these particular, to these particular CBOs in the particular area. And so all of that work together is creating the experience and the track record and the expertise and the experience in working with what is sometimes a fairly messy web of relationships, but one in which we have and maintain an understanding of the different roles and try to envision together what the potential is for pushing outward, because the ultimate goal is creating something that's going to be able to be expanded and extended to the whole nation, and to so that finance and sustainable mindset for enterprise operation can spread to all of the 28,000 community-based water service providers throughout the country. We're a long way from that right now, but we think we're setting out the track record needed. Right now, in working with Danone Aqua, we have one province level bank that we're working with in East Java, and then there are a couple of district banks that we're working with in Central Java, and Water.org is also in parallel working with some other small banks in Central Java and West Java now too. In our partnership with Danone Aqua, the Danone Aqua facilitation has resulted in 99 CBOs financed by the local financial institutions. I should repeat that this is not using donor money for the financing. These are banks deciding to lend their own money based on the facilitation and the technical backup and the security that comes from a relationship with the national program, so that the financial institutions know that they're not making these loans by themselves, that they're working with other partners. So we've seen 99 CBOs financed to date in these working areas. The number of people reached far exceeds the original target. Capital mobilized also exceeds the target. That said, we're barely scratching the surface on the potential here, but we're trying to do it in a way where we are documenting the results, creating systematic partnerships, documenting roles and responsibilities, but doing it in a way that is constantly innovative. We're circling back all the time, trying to figure out what else we can do. So I will stop there. I'm happy, very happy to talk more, to answer questions. But this is an area where I think, in a way, we're barely getting started. Although I think there is also quite a bit to be proud of and for the results so far. So thank you very much.
All I can say is, wow. It's an amazing partnership. And you were talking about documenting things. I hope that there's so many aspects of development that you've touched on. And I hope that I'd like to talk further about how you can get if it's already written up, is it?
We have some case studies, yes.
Great. Well, follow up on that, because and I hope the UN, or there's a website and everything. I hope the UN is aware of what you're doing too, because this is an extraordinary example. As you say, you barely scratched the surface, yet you have laid a foundation for extraordinary potential to scale up and make a huge, even a bigger difference. I'm sure you're already making a difference, but congratulations to you both. And now I'd like to turn to Govert Waramori from Freeport, and he will talk about Freeport's experience with partnerships. And as I said earlier, that during the question and answer period, because you're going to be talking about your partnership with the Ministry of Health, correct? In Papua. So there will be two representatives from the Ministry of Health to participate in answering questions. So look forward to your presentation.
Thank you, Dr. Alene. And good afternoon, colleagues. Please wait a minute. I would like to share my screen, or Mr. Austin, do you have my presentation? Oh, sorry. Okay, there it is. Again, good afternoon, colleagues, and it's a great opportunity for us as a mining company to share what we are doing in terms of partnership in a very special way in public health partnership. I would like to thank also CCPHI for giving us this opportunity to join the International Conference of Public Health, the 6th International Conference. This is our area located in the eastern part of Indonesia, the well known as Papua province. And actually, if you could see the slide in a red zone, it's our contract of work area, which is consists of 10,000 hectares. And this is the topography of our operation area. We located is the one part in a coastal area, which is located in a harbor where we ship our products, and that is a coastal and lowlands. And along the way, about 100 kilometers, it's located above 4,000 meters above sea level, where we do our mining. That's our operation and production goes on. Actually, we also some spots where the employees reside and located and work, and that is impacted our vision to sustain and to guarantee that our workforce should be in a good condition to run their work and ensure the safe production. I forgot to tell you also, we in a range of 100 kilometers, we can travel about 2 to 3 hours. The climate is totally different. When we are in the lowland, we are in a hot climate, while we're up in the our mining area, that's different, totally different. And the terrain is also challenged. Our company, Freeport Indonesia, is a mining company, is a top leading mining company in Indonesia. We produce mostly copper and gold. And we're really concerned about public health. Let's go back to the history in the early 90s, where the workforce is still limited, but since we also interconnected with the local community, where malaria is a great public health challenge. It's a major local endemic disease. So the company decided to set up a new department focused specifically in dealing with malaria. So in doing that, Freeport Indonesia is try to maintain safe and healthy workforce, as well as promoting community health through partnerships. In brief, we partner with government mostly, and we also have society or community and NGOs. Mostly we also join the community to work in terms of public health. Strategic partnership, we ensure this sustainability and also self-reliance. This is the interconnectedness of our public health partnership. We are in the center, and we also surrounding community that we have to also deal with them in terms of public health. And also we have government who have the community and also us. Actually, in terms of partnership building blocks, we build our partnership in common goals. In our operation area, we have common major local endemic diseases, and it's part of SDGs number 3, which are malaria, TB, and also HIV and AIDS. We also come across with the regional and national public health challenges. Just recently, we are now trying to engage more on nutrition and also stunting. Ongoing partnership engagement, we have malaria, we have TB, we also have sexual transmitted infections, including HIV and AIDS. We run together our primary healthcare services, including maternal and child health, with the local community health under health office. We also have, in relation to the pandemic, we also support or partnering with the government for COVID-19. I just would like to present our malaria elimination case study and the background of this malaria elimination partnership is, as I said earlier, local endemic diseases. Malaria, if you see the graph, especially the national graph, also in local Mimika incident rates, you see back to the early 2000, we are above 1,000 over 1,000 population, but now it's going decrease. We also trying to think more about our workforce, because our workforce, it's about 70% reside in the Timika in lowland, where the community, they mingle with the community, so they can also easily transmitted with a public health challenge in the community. We also have target to support or to achieve the National Malaria Elimination Program and local Locally in TIIKM, where we at now for operating and also doing our partnership, it's it's defined by the district head and also the health office that we targeting malaria elimination by 2026 in line with the national program, also SDGs. We also supporting national or Indonesia malaria elimination by 2030. Next year, we have a big event of national sport event that will be held in one also in Mimika and Jayapura. So one of our our malaria control program, the strategy that we do with our partner is factor control, which is indoor residual spraying or IRS. And also now we just finishing the mass distribution of mosquito net, the long-lasting insecticide treated net, and also community health education and active case detection to ensure the impact of the IRS program. Partners in doing this program, we call it Mimika Malaria Center, Health Agency of Mimika Regency, or Mimika Health Office. We have one local foundation funded by Freeport. We also have one local bank, Bank Papua, and also the related by area of community health centers that's belong or under Mimika Regency Health Office. Just to share what we had in last year, 2019, I would like to say that we protect about 26,000 families by spraying the IRS to keep them safe from malaria. We ensure the availability of mosquito net in our intervention area. I will show you next our map where we do the program. 66% of availability, wet net, and also we make sure that 57% utilization of mosquito net, which is very low. Yeah, we in our area, our Freeport sponsor clinics area, it's 67%. The SPR is slide positivity rate, which is our indicator to measure the program in under partnership to do the malaria prevention in TIIKM area. In 2 years recently, we maintained 5%. Back in, we started this partnership in 2013. We start with above 20% SPR. Now we have 5% SPR. We also measure the transmission rate by doing the Sentinel School survey in our intervention area. And we experienced in last year a decreasing of SPR in Sentinel School survey from 4% in 2018 to 3% in 2019. This is just give you all the roadmap of malaria elimination in Mimika. It is stipulated in Bupati decree. Bupati is the district head decree number 3, year 2013. We targeting 2026 malaria elimination in Mimika. This is our intervention area. We do the malaria elimination program in a, we call it Greater Timika, where the dens of the population are located. And now in 2020, we expand the coverage of elimination program to the outskirts of this intervention area. We also have another partnership with mostly with the health office, tuberculosis program or TB program. In year 2019, we have patient visit in our TB clinic, collaboration with the one Puskesmas or health center in town. That's more than 6,300 patients. We also supported the diagnosis of 267 new TB patients. And we also supported the TB MDR program. We got 84 suspects and confirmed 3. We also do the health promotion in relation to TB. That's our partners, Puskesmas Timika, that's a Puskesmas in town, and also Mimika Health Office. In another program, which is STI, and also HIV and AIDS. In year 2019, we had 4,000, almost 5,000 patient visits in a collaboration clinic, and 23 new HIV cases, 1,600 more participating in visiting, and also we had health promotion in relation to HIV and AIDS prevention. Partners are the same, but we also expand to another Puskesmas, which is close to Puskesmas Timika. I would like to share also that we have maternal and child health services in partners with related Puskesmas. We provide the facilities and infrastructure for the program, like buildings, also supporting the programs by providing materials and supporting the manpower, the healthcare workers from our side, and also establishing partnership with the internal and external stakeholders. As a result, in year 2019, we attended through antenatal care of 53 pregnant mothers, facilitate 47 safe deliveries, and also because this partnership going on quite far away from the health facilities, standardized hospital or health facilities. So we had to assisted delivery by family because it happens in nighttime. In 2019, we also served almost 5,000 infant and under 5 visits. No maternal death since 2017, and we had 3 infant deaths in 2019. We have sepsis and also heart abnormality. This is our primary health service. We have health centers in that area, and also we focus on local endemic diseases, including maternal and child health services. This, I would like to also that we have sponsor a big hospital, one in Timika. We call it Mitra Masyarakat Hospital, And also we have 3 PTFI managed clinics working closely with the Puskesmas nearby our area. And that's number of our coverage in year 2019. Our partners, more than 15 of government's public health centers in TIIKM. Just to share what we are doing under public-private partnership in dealing with a COVID-19. We work closely with health centers and also accommodation and isolation centers provided for COVID-19 patients. We also support oxygen canister provision for Mimika Regional Hospital or RSUD, a medical kit and personal protective equipment, PPE, for medical workers. And also we support the diagnosis using PCR. Prevention, we also ran the education campaign for communities in mostly various villages nearby TIIKM. Also weekly talk show, educative talk show in one and only public radio station in TIIKM. Overcoming the impact of COVID-19 in the community, we also support food and fund donation for communities in various villages. Just to conclude, what we are doing under partnership with mostly, as I said, the Mimika Health Office or Mimika Health Agency. The various natural and social challenges in Papua really require collaborative efforts. As I said, that we built our partnership in common needs, common challenges. Also, as a mining company, together with various parties, government and NGOs, we strive to work together in providing optimal and equitable health services for the communities. We trying to do best that the community health will be sustained for the long period of time. Our cooperation in the health sectors needs to be designed by taking into account actual challenges and planning the synergy with local and regional government programs. Actually, we working closely with the government because we know that we have to align all our program with them. And we would like to say that the government, the leaders, they are really supporting, and they ensure the collaborative scheme that will be sustained in a long period of time by release the decree signed by the district head, or I would like to say in briefly that we have a legal standing to do all our partnership. That's all. Thank you very much.
Thank you very much. It is incredible to see the evolution and how you have transitioned. I know Freeport many years ago had to create a nonprofit, and now you're working mostly with the government, which which makes sense. I know that's always been a goal, and it's really fantastic to see how much is going on and the data. I don't know if other people, I've been to Freeport, and I've been to the operation and been to the mine, and brings back memories as you went through your presentation. I don't know if people can truly appreciate how isolated your operation is.
Yes.
there are lots of things you didn't get a chance to have time to talk about, but I know that there have lots in the past. There have been a lot of competition between different groups within the indigenous population, and so
Yes.
working through all that as a mining company is I congratulate you for all the progress. It's really so
Challenge,
impressive.
yeah.
And a challenge, yes, of course.
Thank you.
Well, thank you. And I'm looking at the time. We started late. Austin, do we have to end at I'm looking at my watch. It's not your time. What time do you end?
40 minutes left.
We have 40 minutes left?
Yes, we do have.
Great.
So you can continue this.
Okay. Well, I definitely want to give people a chance to ask questions. And as I said at the beginning, I have some questions of my own. Let's open it up first to see how many questions there are, and then I can come back and ask some of my questions, because this is interactive and I want people to have a chance to ask you about your partnerships and some of the skills, well, whatever questions they have. So could we either put your question in the chat room or raise your hand? Then let me start, because I want to make sure that you all benefit from this expertise that's in the room. To go through the list again of what we were, I want to just check chat. I don't think there's anything. Okay. We talked first. We want to talk about networking and building a reputation for collaboration, and I think you've talked about that. But CCPHI, could you just say a little bit about Sonny? Could you say a little bit about what you do through networking to help build trust, relationships, and trust? How does that work? And you are now running a health forum in addition to the partnership forum, and there's also the building trust issue in your EPSP, your executive program with Paramadina University. Could you just talk a little bit about what is most important in terms of how you go about helping them build relationships that lead then on to trust?
Thank you, Alan. Yes, I think holding a forum or the discussions, it's one way to keep enabling the networking between organizations through communications, through our social media and website. And I think the other thing is, especially in these pandemic situations, one of the important things is to become active in several other forum as well, whether it is a forum organized by another associations, another NGO, or by the government. So keep the CCPHI is exist in the community, and yeah, keep the communications still communicate with the members, offering the members to, if they have something idea that we can work to collaborate with, and holding a forum like a webinar, something like that.
What do you think is the most important element to building trust? I mean, you have guidelines, and you know, from the beginning, we worked with, we had guidelines that came from an example that was working in the human rights field to build trust between businesses and nonprofits. Do you have, and now you've had that foundation and you've been building off of that, and you maintain trust, but do you ever have any problems with people not trusting each other after all this time?
I couldn't say that in general. There is still a stigma between corporations and NGO not trusting each other because they have their own perceptions of the behavior respectively. So what we do is, of course, we are building our own reputations first, then it's built up from a track record, who we are, and trying to be neutral, not speaking in their own language. If we communicate with NGO and CSO, we speak their own language. And when we are talking with the corporation, we talk the corporation language. So it is important to being natural and speaks on their language. And also being open and not judging. That's important as well.
Would any of the other panelists have any comment on the trust issue?
Based on our experience, we have to back to the point in every items that we agreed to do together under partnership. We have to do in advance. For Freeport, we have to more active to do all the partnership point. That's how we try to build the trust with our partners. We always come first to do, and also ensure the monitoring and evaluation. I agree with Sonny that communication is the root for building trust. We have to ensure that we have regular communication to see the progress of partnership. Thank you.
Thank you.
Perhaps I can add.
Yes, please.
Yeah. All right. Okay. So I think quite interesting to talk about trust, and then I will give a real example on our partnership with Water.org, which is even now we really, I would say, being true and very close partners. But of course, it when we engage in the very beginning, you mentioned about the importance of having a network, because at the end, if we don't have kind of a good network, then maybe we don't know, we are not really able to meet our partner, which is Water.org. And then when we establish the partnerships in the beginning, of course, it is not always easy, because we as a company based in Indonesia, and then there are many challenges also related to the topic in Indonesia, whilst Water.org is actually credible, reputable organizations based in the US. And then, of course, before we establish the partnership with, both organizations need to have kind of a due diligence to understand the partners, because at the end it is going to be a long-term partner. And then during that time, actually in Indonesia, in the middle of the establishment of water law, and then we as a company also, affected, quote unquote, because we are using water as our raw materials, as a water company, as a beverages company. Therefore, of course, there are some always during the establishment of the law, there was some, pro and cons, the discussion in the parliament is always, right?
Mhm.
But the thing is that, of course, we, as a company, we need to convince, to show that basically we have the good intentions. We are the company with a very good governance. We are transparent. We are trying to bring impact. And then, as I mentioned before, we are quite open and transparent to share, the situations. So having a several dialogue and discussions openly with our partners, potential partners, this is something very important that at the end, now we are really able to build trust, and then we all believe that both, partner is really credible and have kind of a good intentions, a mutual, objective to bring contributions to address the challenges to the health, water, of course, one of the topic to Indonesia in general, basically.
Thank you. Can I want to move on then to, oh wait, there are a couple of questions. So let me yes, this one, there's a question about to water.org and Danone Aqua. Was there any red tape with government, and how was that overcome?
Well, I'll give my answer first. The most important thing here, rather than thinking about it as red tape, in establishing our partnership with PAMSIMAS, with the government program that was setting out the CBOs, the most important thing for us was to understand the objectives of the government in setting out this program, and then finding the way that we could align with what we knew were the objectives in the program, so that we could present ourselves to the government as helping solve the problem that they wanted to solve, so that to understand the government institution enough as a potential partner to understand what their goals were, to align with that, to find out what we could, how we could change our messaging to move with that. Now, we can say that, and it has worked out that way. There are also, long periods where patience is necessary. We are a small organization working to support the government and to introduce some new solutions into the way the government works, and that takes a while. You do this in stages. The first stage is essentially getting a no objection to try out your work in the field in a limited number of areas, and that's how we develop. That's how we showed a track record, and then we had the track record. We developed a reputation for keeping our promises and commitments, and that provided the key for sitting down with PAMSIMAS at the national level again and being able to develop an MOU and then later a cooperation agreement, and then being able to influence the standard operating procedures they were setting out for how all CBOs are supposed to operate, as well as the national training curriculum for all of these CBOs. So it's something that develops very much in stages, really more by proven track record and being able to talk about the successes and point to how the successes in the field support the goals of the institution.
Thank you. Now, there's the things that keep coming up are communication and understanding and being open and working it out from the beginning and maintaining it. There are two questions that are kind of combined. I can kind of combine them. They have to do with how do you work, how do you communicate, and maybe I should go further, engage the communities. One question is did you have challenges with trust when it comes to the communities? and what kind of, how do you bridge, well, let me put it this way. How do you communicate with how do you understand the communities and ensure that you are communicating with them effectively? I hope I captured your question correctly. I would like to speak to that.
Please allow me. Yes, communicating with the grassroots community is a challenge. For example, in a building like what Danone's program in providing water access. So that's where the NGO position is very important, because there are much better positions to talk directly to community compared to corporations. And building up understanding and trust, and moreover building up an organizations in community to let them understand, to let them have the shared vision. That's one important thing, I think. A shared vision, a shared goals between community and corporations.
Can I ask you to elaborate a little bit, or the other panelists? One of the things that I remember vividly when I lived in Indonesia was, it was actually at Freeport, when we were visiting Freeport, and we were having a conversation with community leaders. But all the women in the room were sitting on the outside. And we weren't sure whether we were hearing from the community as a whole, or whether it was the community leaders who were giving their impressions of what was needed, but it was not a holistic description of everybody's perspectives necessarily. And so can you speak to that a little bit? How do you know when you really have you know, it's great to have an NGO, but there are a lot of instances when still the community, you know, how do you know that you've really gotten what the community really needs?
That's true. When we experience how to build trust with the community, because in Freeport we have community as beneficiaries, so there is a level, or more than a level, in the community, and they have elite groups, mostly the chief with his family or his relatives, the same clans or the same family, while the others, they left behind, mostly the women. So in approaching with the community to deliver our program in partnership, or assisting the community, or in partner with them, we have to see them as a whole, because we touch the health part, we come easily to touch every people in the community, or women, child, teenagers, youth, and also the leaders. So from that approach, we try to always build their trust to reach the goal of our program. But we, as Sonny said, that's a huge challenge to deal with the community, especially in our community. They always put their hope, and sometimes they are more relying with the company. Also, when we come with our partners, they also put their hope and trust in us. And sometimes it's over, and we have to deal more with some agency like government, because based on the regulation, we can create some partnership under the regulation in Indonesia between public and private sector. Thank you.
Thank you. Anyone else?
Can I
Yes.
add, Alene?
Yeah.
I think there is one tools that could be useful as well, is that we can do a stakeholder mapping before we start doing the program. So by mapping who is the stakeholder for the specific issues, then we can know who to talk to and who to engage to get their support prior to implementing a program.
Thank you very much. That's helpful.
For
Any other?
us, you know, the biggest challenge, the single biggest challenge is normally convincing a village and convincing the village water board that their enterprise can operate sustainably and that they won't encounter disaster if they try to borrow and then they fear they won't be able to repay the loan. And you know, that fear is something that needs to be overcome. And yet for me as a longtime banker, I love seeing that. It's a great place to start because it means they're serious about the obligations that go along with borrowing. You know, so we work, you know, the way we work with that is that water.org, of course, never arrives in the village by ourselves. We're going with the local, with the PAMSIMAS facilitator who has helped to set up this community-based organization. And then when we are really trying to get what we consider good operating villages to become interested in borrowing so that they can expand and serve more households, we will very often bring in representatives from another village board that has already borrowed. We've reached the point now where we've got people who can be success stories, be living success stories. And that is the single most persuasive technique that we've found, is that when somebody who's very much at the peer level is talking about how they were able to borrow from the bank, they had thought out the use of their loan, they had focused on cash flow, they were able to repay the loan and serve more people, and there was no disaster involved in doing that, then that is something that goes further than almost any other technique in convincing people that the idea is going to be sound, that they're not doing it, they won't be left alone, they will be doing it in partnership with others, and that it offers the opportunity to develop.
That makes huge amount of sense. And I had a question when you were giving your presentation. I can't remember if either of you on the partnership between Danone Aqua and water.org mentioned how do you ensure the sustainability of the infrastructure? Is that incorporated into, you know, the pipes and everything else? I mean, so that the borrowing is one issue, but also just is there a system so that they can repair them, you know, and have the resources they need to repair, make sure that continues to work?
There is, and this is, you know, this is something that is, the idea is to build this into the structure of the program, the PAMSIMAS program. There's a management information system where the community-based organizations are rated according to the sustainability of basically their success and the quality of what they're doing, so you can see the level of sustainability of the different villages. there, that said, there is, our whole goal is to see them become more sustainable than they were, and that is to improve the quality of the product they're delivering, which is piped water, and also to get them to think about cash flow and the potential for serving more people in the village. And so sustainability is a challenge. There are plenty of CBOs that are essentially allowing their infrastructure to run down, and then will sort of wait in hopes of another government grant in the future. And part of the challenge for us is to not only choose the good ones to work with now, but to have the training and the we call it demand generation, but there's quite a bit of awareness raising as well, so that more and more CBOs will understand the vision of being healthy in terms of their operations, so that they can continue to serve the households they're serving and expand.
Great, thank you.
Yeah, if I can add, yeah, in this case, very important to really involve the community through the participatory concept approach. So means that how to ensure that the community will really have kind of ownerships and involvement of this initiative. Yeah, but Don already mentions that we have kind of also quite series of a training program to involve the community to understand what is this. And then of course, normally in the CPO, in the village, there are not many, but there are few people who can be kind of a local leaders, who genuinely wants to be part of the change. So then we need to be able to really identify who are the local leaders, and then we engage them to really work together to create kind of an impact. So this is something that normally also we do when we are working with the CPO at the village level.
Thank you. There's another question. Oh, sorry. Does someone else have a comment?
Yeah, I have a comment. First of all, I'd like to congratulate all the speakers and you as well, Alene, for the fantastic job being done in Indonesia on this partnership and this trust building between the NGOs and the government. I have a comment, or maybe a question actually. I noticed that the water.org, Danone, Aqua, and the Pamsimas combination in three of them getting together and doing a fantastic work in the rural areas for the water supply. My first question is Pamsimas itself, being the government agency, doing anything on their own in terms of the water supply systems, because they have a budget through the Sustainable Development Program? I'm sure they have a budget. So are they doing anything on their own, or are they just letting this being done by water.org and Danone Aqua separately and just leasing it out? That's the first question I want to know. Because in different parts of the world, for instance, I'm from Malaysia, we have actually the government itself taking a project in the rural areas in terms of the water supply. But since now 90%, nearly 100% of water supply is by the government, so we don't have that much of a problem. So the issue is Pamsimas just dishing out the money to Water.org and Danone Aqua? That's the first question. The second question I have is actually, is this a profit-oriented concept of the water system? Because if you are profit-oriented, especially in the case of Danone Aqua, it's a company, unless it's doing community service project as a community service project, where they actually spend some money to do a community service. But if they're not doing a community service project, the chances are this project is profit-oriented. And which means the government, which is Pamsimas, will prepare a budget, and then there's a cooperation between Water Org and Danone Aqua to do the projects in the field. And the difficulty I understood for me to understand is you have now rural folk who have to take a loan, of course, mini financing, microfinancing. You have to take a loan. I know that 97% of them are able to pay back, but are there problems in terms of financing? That's the second part of the question. So I hope maybe someone can answer some of these questions. Thank you.
Would you like to reply?
Yeah. The first thing in running through the presentation as fast as I did, one of the things to keep in mind is the sense of scale and proportion here. That PAMSIMAS is a government program serving more than 28,000 villages with water infrastructure. We're working right now in our the Danone Aqua team has facilitated finance for 100 of those. Working in parallel, Water.org has facilitated finance in different areas for another 250. So the work we do is very, very small compared to the work of government. The real hope for not only sustainability but scalability is being able to influence the way the government program works.
Sorry if I may interrupt. Sorry for that. Is PAMSIMAS having their own projects and doing the supply system, and you are now just supporting the system?
Right.
They have their own.
Yes. PAMSIMAS is the executing program of the government, of the Ministry of Public Works and Housing, to set out not only the infrastructure, the basic infrastructure in the village, but to train the local people in setting up how they should operate. And so our goal is to over time has been to help them change their orientation to be a little bit more commercial minded, to think more about being profit oriented enough to be sustainable, to achieve full cost recovery, so that they can continue to offer the service over the long term. And that, to find a way to keep the social motivation that underpins the work of everybody on the water board, because nobody's really getting paid for the volunteer work they do in operating the enterprise, but making sure there's enough cash flow to cover maintenance costs and to be able to expand service over time, and to borrow microfinance to help speed up that expansion a little bit. So yeah, the goal here for us is certainly to do as much as we can to facilitate that development of relationships between local financial institutions and the community-based organizations that are being set out by CBOs, and they're to be in a sense kind of a matchmaker, and certainly doing a lot of introductions in the middle for this work. We're also, our goal is to develop enough of a track record always to move on to the next financial institution, to get the next financial institution in the next area interested in doing the same thing, and to make sure that the local people in the PAMSIMAS program have are not doubtful, that they have enough confidence to move the orientation of their program a little bit more towards being finance friendly. So
you're really a bridge between.
On a good day, yes. Not a barrier.
Yeah, I can add a little bit of right, because actually, the financial institutions or bank, product related to the sanitations, I would say is non-existent before in Indonesia. So therefore, I think with Water.org is trying to introduce this microfinance for sanitation, it is new. Therefore, I think it is quite crucial to engage with the financial institution, with the bank, to be able to see this is an opportunity for them as well to grow their business and opening the access for financing to the sanitations. And then there was also questions about the profit oriented, whether our initiative is a kind of a profit oriented initiative. I would say this is not, because actually this is not our core business as Danone Aqua. So what we are doing is more on kind of a sustainability initiative where when we invest on the training, on the development of the CBO together with Water.org. But of course, the CBO at the end, our community-based organizations, has to be profit-oriented for them to be sustainable in the futures.
You mentioned in I can't remember. Oh, it was in your presentation, Karyanto. You mentioned a B Corp.
Yeah.
And now Danone is a regular company, but a B Corp has a social function, correct?
That's what.
Yeah. Yeah.
So
yeah.
So is the B Corp separate from Danone, or is Danone? I thought you said it was one of 1,000 B Corps in the world.
Yeah. So actually, B Corp is the certification for profit organizations. Yeah, it is a certification for profit organization conducted by B Lab based in the US. So actually, it was started with the SME, more on SME organizations being certified by B Lab to be B Corp company, and Danone actually really wants to be a pioneer as a multinational, to be certified as a B Corp. And to be honest, because we have been also experiencing in this certification, it is not easy, to be honest, because we have to really really follow all of the certification process, the requirement, etc. and so forth. But actually, this is now lead to Danone, we just announced to be social enterprise organizations, or perhaps in the US kind of a public benefit corporations. This is actually the way that we want to go in the future. And then B Corp can be one of the way to be in the public benefit or social enterprise corporation, if it is in France. So and then of course, as part of the B Corp requirement as well, where relevant, we need to also adjust in our article association to ensure that we adopt the kind of social missions to be adopted in our article of associations.
Thank you. Thank you. Do we still have any time?
We still have 5 more minutes. So
okay, great. I lost track of time. I forgot to look what was 40 minutes. Does anyone else have any questions? I have a list. So
maybe I can just finish the 5 minutes. I can finish it.
Okay.
Danone Aqua. Danone Aqua is very, very active. But I noticed one component of Danone Aqua is also the nutritional aspect.
Sorry.
And the nutritional aspect are they at nutritional aspect? You have nutrition. And you also, I noticed advertising milk and other products. And if you're advertising milk, and in terms of indirectly, because for maternal and child health, most following the WHO requirement, you are not allowed to advertise infant formula, which is below 1. I don't know whether you're aware of that. And if that is the case, could you be indirectly advertising your infant formula by giving the nutritional products to the stunted children, etc.? Difficult one.
Yeah, I can answer this. Yeah.
Because you're actually indirectly advertising infant formula, which WHO does not allow worldwide. So I'm surprised that Danone is actually going around there with the milk formula. And I'm surprised that other companies are not reacting to your activity in the rural areas. I don't know whether infant formula is banned.
Yeah. So basically, of course, we understand, your question and also your concerns. But the thing is that we comply with the WHO code, which is related to all of the marketing on this product, basically. So you see, if you see, like in Indonesia, we don't really communicate on this because we comply with all of the WHO codes and relevant codes related to this product. The same, like for example, you are talking about the stunting. Of course, in this case, we don't really promote this product just to address the stunting, because this is not aligned with the WHO codes.
Okay, best of luck. I was very impressed with all of you, and I wish you all the best.
Thank you for your questions, and I wanted to just ask a couple more, a couple quick questions because I think people often don't appreciate how long does it take to start and get to the point of having an MOU or a cooperative agreement. In your experience, can you just give a quick answer on average? How long does it take to do that?
So of course it is not there. Okay, I can start first. Yes. Okay. It is not. There is no. To be honest, there is no fixed. Timing. How long it takes. Sometimes it takes. Quite sometimes, but sometimes it is quite fast. But it can be in the range. Perhaps. I would say sometime in 1 year within 1 year we should be able also to have kind of the MOU, depending on the complexity of the initiative. But again, for the new partners, for example, with the completely new partners, as we discussed before, how we really build common visions, trust. This is key before we really move to the next step.
Thank you.
I would say, again, it's about trust, reputations, and track records. Sometimes you can go faster than others. Just for example, on my past positions as a sustainability director before Karyanto in Aqua, when we start a waste management, it's just let an organizations like Waste for Change presented, then we gave them an opportunity to start the works. So again, it's about trust, about relationships, and also when we start the coalitions of sustainable packaging, a process within the organization itself. It's, for example, when we start to have the MOU between more than 2 organizations, that it depends on the internal process of the organization itself. So that's 2 parts.
That's very, very helpful. Thank you. Well, we could go on all afternoon, but we run out of time. I want to thank all of you very, very much. This was, I learned a lot, which is what I always love about for us to put together this workshop. And I look forward to hearing more about each of your partnerships. I will probably be in touch with you because so many things that you have shared. I hope we can figure out a way to share it even more widely. And I know that's one of TIIKM's objectives. So thank you again, and wish you all the best.
Thank